Welcome back to another video in our residential series. Hi everyone, I'm Alex from My Progression, and today we're going to be looking at health, safety and first aid in a residential setting. It goes without saying that for any service users, the priority will always be their health, safety and well-being. This video is going to look at the kinds of hazards that may be present in a residential setting, how to risk assess these hazards, and how to manage or control a situation to make sure that any harm or injuries to service users are prevented. When it comes to health and safety in a residential setting, there are 4 steps that can be used to make sure that everyone, service users and staff members alike, are kept safe. Step 1, identifying hazards. A hazard is anything that could cause harm or injury to anybody in a residential setting. So let's take a look at what hazards could be found in a residential setting that may become a health or safety concern for either the service users or support staff. The common hazards found in a residential setting include beds or equipment. A surprising amount of injuries have happened when service users have become caught or trapped in heavy equipment that is designed to help them. Slips, trips or falls. This could be because of anything slippery on the floor because of the weather, objects being left where people can fall over them, or even service users with limited mobility who need support to stand or walk. Medication management. Medication can only be administered or managed by authorised staff members to reduce the chances of serious consequences or illnesses. If someone took medication that was not designed for them, it could result in a medical emergency. Hot water, substances or surfaces. More independent service users may be able to make their own food or drinks, which creates a risk of burns due to boiling water or cooking equipment. The spread of infections or diseases. Residential settings are particularly susceptible to illnesses due to the nature of the setting and the vulnerability of the service users. Handling and storage of hazardous substances or equipment. This may include cleaning substances, which must be stored appropriately, or the safe disposal of any biohazardous waste, for example, needles or sharp bins. Manual handling. This includes the moving, lifting or transporting of service users with limited mobility. Service users may need equipment to aid with transporting, such as walkers, sticks or hoists. Fire safety and procedures. This includes the processes in place to prevent fires and the steps taken in an emergency situation. Food safety and hygiene. This includes anything from preparing food, cooking food, and the cleaning or sanitation after the meal has been eaten. And the possibility of aggressive or challenging behaviour. If a service user struggles with anger outbursts or behavioural challenges, it's important to keep the service user and everybody else around them safe. In the first instance, each residential setting will have their own policies and procedures in place to address any health and safety concern that may occur. It's important to be aware of all of these policies and procedures in case of an emergency, and to make sure that any reporting processes are followed should a health and safety risk be identified. These policies and procedures are particularly important in a residential setting, as service users may have conditions that mean they're likely to become confused, distressed, or may even have an emotional response to an emergency situation, such as a fire alarm. By following the processes in place, it means that service users can feel safe and prepared for any eventuality, and all staff members, whether permanent or temporary, are aware of all of their expectations and responsibilities. As a temporary staff member, the priority should always be to familiarise yourself with the policies and procedures of your setting before supporting any service users in case of an emergency situation. So now we know what the hazards are, we can move on to step 2. Determine who is at risk and why. The policies and procedures in any residential setting are designed to increase the safety of the setting. They do this by assessing the risks of the situation, which then determines the chance of somebody becoming hurt or injured. The risk in these situations has a look at the likelihood of the incident happening and the severity of the injury should the incident occur. For example, if a cupboard in a service user's room has a soft close mechanism, then the likelihood of the service user getting hurt is slim, so should require little supervision. However, should the likelihood and severity of an injury be high, then the health and safety risk increases and steps will be needed to be taken to keep the service user safe. For example, if a service user with limited mobility wants to move from their bed to a chair, they could really hurt themselves if they weren't supervised. But a staff member could also hurt themselves without the proper training. To ensure that everyone is kept as safe as possible, a hoist may be used, or another staff member may be called who is authorised to assist with manual handling. So now the risks have been determined, we move on to step 3, implementing safety measures. Health and safety measures are put in place to reduce the risk of anything happening to a service user or staff member. These safety measures could look like having more than one staff member supporting a service user with more profound difficulties to prevent injuries when moving or transporting. Making sure that any equipment is stored safely when not in use. Removing any trip hazards, such as cables or mats from public spaces, and using wet floor signs where necessary. Ensuring that all fire exits are accessible at all times and that fire doors are not blocked or propped open. Cleaning and sanitising all surfaces where food is being prepared, handled or cooked. Cleaning up any biohazardous waste in line with safety protocols, such as human waste or fluids. Supervising more independent service users through their day-to-day tasks and troubleshooting whatever they may be doing to make sure they are safe and independent. For more information about the health and safety measures of a residential setting, always check the policies and procedures or ask the member of staff in charge. For more information about measures that you can put in place to support service users in a residential setting, view the rest of our videos in our residential series that are linked below. And while you're there, like, subscribe and click on the bell to keep hearing more from My Progression. Don't forget, you can also receive downloadable certificates to prove your learning. Now, you can be as prepared as you possibly can be, but sometimes new risks can occur that might not have been considered. If you see anything that is broken or something that could cause an injury to either a service user or staff member, it must be reported immediately. Failure to report something could result in somebody becoming seriously hurt or could mean that the equipment doesn't work as intended when it's needed, causing injuries to staff members. If you're unsure if you should report it, report it. Now finally, we come to step 4, review regularly. Each residential setting will have their own management team who will be responsible for reviewing their current health and safety measures and adding anything new that might appear. But as a staff member, it's just as important to remain vigilant and regularly review the safety measures that are in place. Staff members are the barrier between a service user getting hurt or a service user being safe. So by making it standard practice to review the safety measures in place, it will make the residential setting as safe as possible. While health and safety measures can be put in place to minimise the chances of a service user or staff member being hurt or placed at risk, accidents can happen. So in these instances, what can be done? First aid might be needed in the first instance if somebody has been injured or hurt, but only if you can do so safely without putting yourself at risk. Picture this. You've walked into the kitchen and found a service user on the floor. They've dropped their drink, which has caused them to slip, and now they've banged their head on the way down. What would you do? First, it's important to assess the dangers in the situation. In this scenario, the floor is wet, which has caused the service user to fall. If you run into the kitchen to help them, you could fall yourself, which would only make the situation worse. Start by reassuring the service user that you're here to help and then make a clear, safe path to the service user to help them. Next, call for help. If the service user was seriously injured, you don't want to leave them on their own while you go and get help yourself. Each residential setting will have different protocols about how to get the attention of another staff member in an emergency. Some will have radios that can be used to get in touch with other staff members. Others might have red pull cords from the ceiling, or if the service users are independent enough, one of them could go and find some help for you or bring you a first aid kit. Now you've been able to safely approach the service user, assess the situation. Remember, every residential setting will always have an authorised staff member who is a qualified first aider. But while you're waiting for them, you may need to intervene. In this situation, where a service user has fallen, advise them to stay still until help arrives. The last thing you want is them slipping again. Ask them what hurts, and if you see any bleeding, apply pressure to the wound until an authorised staff member arrives with a first aid kit. Most importantly in these situations, reassure the service user that they're going to be okay. Slips or trips can be a shock for anyone, but particularly for a service user who may become easily confused or distressed. Keep talking to them until help arrives. If they're talking to you normally, that's usually a good sign that they aren't too injured or hurt too badly. When help does arrive, explain what has happened and assist where you can. After everything has calmed down, remember to report the accident to the manager or staff member in charge. It may mean that the service user who fell might need additional support in the future or a change to their care plan. Or it could be that a wet floor sign is needed in the kitchen to prevent any falls in the future. Keeping service users safe is always going to be the most important job for any residential support worker. But it shouldn't be intimidating or scary. When you hear the words health and safety, remember to think of the 4-step process. Identify hazards, determine risk, implement safety measures, and review regularly to make sure that everyone in the environment is safe. I've been Alex from My Progression, and let's keep your career in motion.